It's been a real pleasure. I've been here for working with the Center for the last few days. I have to say, 30 years ago, my Hebrew was good enough that I could have spoken, given this presentation in Hebrew, but I knew nothing about air pollution. And now I know a little about air pollution, but it took the space of my brain where the Hebrew was, so I won't even try. So I'm going to talk actually quite broadly about work I've been doing maybe over the last 10 years on really focusing actually on healthy cities and the role that air pollution, but also other environmental factors play in cities. So this is actually the challenge. Over the next 40 years, about 70% of the world's population will live in urban areas. Israel's already there, so 90% or more of the population are in cities, and it's quite interesting actually. Cities are going to absorb all of the population growth of the world. So when we actually think about environmental health, now in many parts of the world, including Israel, including Canada where I live, and certainly in the future, it's really the health of cities that we need to think about. Many cities, when they actually think about environment today, the only thing, and I work a lot with the city that I live in, all they think about actually is climate change. When they think about environment, it's almost as though they're ignoring the environment today and thinking about how they can improve it for the future. And I think everybody, this is obvious to everybody, but any actions we do today in terms of mitigating climate change, the impacts are not going to be felt for 100 years. So if we have carbon reductions today, it's 100 to 300 years before we're actually going to see the benefits of that. But even without climate change, we should all remember that there's important environmental health problems in cities that we actually have solutions for. And thinking about if cities still have this agenda to think about climate change, we should actually capitalize on those and use those as opportunities to improve the environmental health situation in terms of the exposures and stressors that we face today. So very, very generally, I don't know how many air pollution experts there are in the room. For those that aren't, I'll go through just some very general basis of what we know about air pollution and health. Hundreds of cities now across the world have done studies that show on days when air pollution is higher, more people die, and it's primarily dying from cardiovascular disease. We also know from a smaller number of studies that in the more polluted cities in the world, people die earlier than people living in less polluted cities. And again, primarily from cardiovascular disease. And again, this is controlling for other risk factors. More recently, we're also understanding, and this is really what's relevant to what I'm talking about, that if you actually look at the most polluted areas of cities, there's an increased risk of dying from cardiovascular disease, and also disparities in other health measures that are linked to air pollution. I'll give you some examples of that. It's very important, actually, when we think about environmental risks in general, air pollution is no exception, to think also about other factors that affect health. This is just a slide from the Global Burden of Disease study. This is actually now outdated. This is done for the year 2000. But what you can see is actually some risk factors that are what are called modifiable risk factors that actually we can do something about. So some things, genetics, we may not be able to have any impact on genetic predisposition towards diseases, but these risk factors in terms of public health interventions, we can actually affect them. And when we look at them, this is now broken up by sort of level of development status as well as geography. So if you just focus on the yellow, those are the high-income countries, and I would put Israel in that category. Air pollution is, of the environmental risk factors, it's the number one in terms of its contribution to disease burden. And this is done through a systematic process. During this exercise, about 800,000 deaths per year in the world attributable to air pollution. I can't show you the data, but I know the results. We've just redone this. This will be published in the next few months. For a number of reasons, this number has increased to about 3.2 million deaths annually in the world attributable to air pollution. And again, comparing it to about 65 of these modifiable risk factors, including dietary factors, physical activity, a few other environmental factors, smoking, etc. Air pollution is quite high up, and it's actually rising up in highly developed countries. So this is unfortunately not a problem that is gone, even though actually I would like it to be gone. And this, you can just see from this map, is sort of the global distribution of air pollution in the world. And I won't go into the details of how this was produced, but it's involving satellite data, measurement data, and some other information. Just looking more specifically, this is just the European region of the World Health Organization. You can see that most of the populated areas are actually above the World Health Organization standard for particulate matter. And so this is sort of our estimate of kind of a health-based standard. Most of the populated areas are above that, some well above that. And actually the Middle East is one area in the world that has some of the higher concentrations. We also know actually what to do about air pollution. This is where I live, Vancouver. This is a picture taken in the middle of the day in 1939. Very typical. And we implemented many air pollution controls. First, sort of the normal things about zoning and tall stacks, then more advanced airshed management, motor vehicle emission controls, etc. And this is sort of what Vancouver looks like today. Primarily as a result of controls actually in zoning are the two most important things. And so this is just in context. So I also want to point out that most of the work I'm going to present sort of about within city gradients is done in Vancouver, and it's probably the cleanest city of its size in the world in terms of air pollution. Having said that, we can actually still detect health effects. So that's perhaps a little bit sobering. Some examples of interventions in terms of air quality management and their impacts on health benefits. So this is a study in Hong Kong where they lowered the allowable sulfur content in fuel, and the levels of sulfur dioxide decreased. I don't think I have a pointer from the so I'll use the mouse. So the levels of sulfur dioxide decrease as well as some components of the particulate matter, and you actually see in the year after this measure went into effect, this seasonal pattern where you would have increases in respiratory mortality was actually gone. And also effects on all-cause mortality and somewhat of a lowering of the normal cycle of cardiovascular mortality. So the conclusion actually from this is essentially you bought everybody in Hong Kong an extra year of life, or somewhere around that. They still, if you look farther on, they still have to die. Unfortunately, if we remove air pollution, we're not going to live forever. We still do have to die, but you gave people a benefit that was measurable. Looking at this another way, this is a paper many of you have probably heard of that looked at the reduction in particulate matter in cities and counties across the U.S. and looking at the change in life expectancy. And although there's a lot of scatter, this shows you that air pollution is not the only thing that's responsible for changes in life expectancy. But the estimate was about, of the increase that was measured over this 20-year period, that was about 3 years, about 15% of that was attributable to air pollution, which is huge. It's actually much larger than anybody would believe. What's the reason for this? Well, the reason for this is even though the effects of air pollution on an individual's health are actually very small, when you aggregate across the whole population, everybody's exposed. And you can actually contrast that with something like cigarette smoking, where the risks to an individual are very great, but because not everybody smokes on an aggregate population level, the impacts aren't as great as they would be as everyone smokes. So that's really what's going on here. The other point to make is that air quality regulations, because of this fact that they affect the whole population, they're very cost effective. And the example here is that in the United States, any federal regulations, you're required to do a cost effectiveness analysis. And of all, and this is really striking, of all the laws passed by the federal government,
air quality regulations are responsible for the vast majority of the benefits accrued by the regulation, and by far the highest ratios. Depending on which analysis you look at, it's either a 4-to-1 or a 30-to-1 benefit to cost ratio. So the message is that air quality management is very cost effective for a society. Having said that, even though we've done a good job looking at sort of the managing the regional and perhaps the urban air pollution, there is this other part of air pollution, the local factors, the local sources that in most places in the world aren't routinely measured or managed. And that's really what I'm going to turn to today. What is one major source? Well, it's pollution gradients that relate to proximity to roadways. These are just showing you for a variety of pollutants as a function of distance from a road. You can see a very sharp drop in their concentrations, which is good, but for people who may live, work, study within this zone of 100, depending on the pollutant, to 200 or 300 meters from a road, they're actually in a high exposure zone, in a hot spot. And when we aggregate that, when we look at these across cities, and this is a result of a technique that we use called land use regression mapping. So we make a whole bunch of measurements. At those measurement locations, we characterize the geography. So we typically are looking at about 160, 170 geographic variables. And we simply model those variables in relation to measured air pollution. If we get a decent relationship, now we can actually predict air pollution across the whole space of an urban area at very high spatial resolution, a resolution of about 10 meters. And so we can get these kinds of maps, and you can see sort of a detail here. We're also doing the same kind of thing with a different approach for noise, which is much more of a physically based model, understanding noise dispersion. And we know that this traffic pollution leads to higher levels of air pollution, higher levels of noise in these zones around roadways. Who does it affect? Well, again, I was quite surprised when we actually did this analysis. You simply sort of overlay these zones of exposure on population data. In Canada, about a third of the population lives in these zones, and more than a third of the schools are actually located in these zones of high exposure. At least in Canada and in the US, the reason is that's where land is cheaper, near higher roads, so that's where we put public facilities like schools, like hospitals, actually places where our most vulnerable populations are. So we've done a whole number of studies now using these kinds of maps, and we've done this for many different pollutants and related it to measures of health. And in Canada, we have universal health coverage, so we actually can do population-based studies where we're measuring every single hospital admission, we can measure every single death, even outpatient visits, and we have high-resolution spatial data knowing where people live in these databases. So here's just an example of things we've done looking at children's health. If we look at low birth weight or preterm birth, living within 50 meters of a major road in the city, that is associated with a 20% increase in low birth weight. We've also seen the same associations with preterm birth. Bronchiolitis, which is a respiratory infection, and it's the main reason actually children under the age of 1 get admitted to hospital. The same kind of thing, but a lower risk, 66% increased risk of bronchiolitis for those children living in these exposure zones. We're also seeing now consistently, both studies that I've done in Vancouver but also in Europe, that this exposure to traffic-related air pollution seems to cause asthma. Prior to this, there's actually very little evidence to show that air pollution leads to developing asthma. We know air pollution makes asthma worse, but it seems very clear now that it can actually, this sort of traffic-related air pollution can cause asthma, and we estimate that almost 15% of asthma is attributable to traffic. So childhood asthma, 15% of that is due to this traffic pollution. And also, quite interestingly, looking at middle ear infections, those of you who have or have had small children know how traumatic this is, both for the child and the family. This is the main reason that children under the age of 2 actually see a physician, and the main reason that children are prescribed antibiotics. And about 10% of the cases of middle ear infections are attributable to this traffic pollution as well. So that's children. Again, what can we do about it, or what do we know about interventions? This is a study I love, and I didn't do it. But this is looking at New Jersey at a toll road, and they used to have this sort of old system where you had to stop at the road and pay, give them money. So every time there was one of these stations, there was all this congestion. And then they went to a higher tech system where you just drive through with a transponder, and you get a bill later. And what it does is it reduces the congestion and lowers the air pollution. They compared mothers who gave birth within these zones around these toll plazas, actually compared them to mothers who still live close to the road but not close to these toll plazas, and then looked before and after they made this change. And again, really dramatic, a 10% decrease in premature births and a 11% decrease in low birth weight after implementing this change. Had nothing to do with public health. This was just sort of for ease. So it's actually free, a free health benefit, and very dramatic effects. So another study that we did, so this is looking at cardiovascular deaths among adults. The baseline are people who never lived close to traffic, and there's sort of different levels of exposure here. People who, during a 10-year follow-up period, always lived close to traffic, they had about a 55% increase of dying from ischemic heart disease. The interesting thing, though, is people who moved away from traffic during that period, their risk dropped almost all the way down to baseline. And actually, people who moved closer to traffic during this period, their risk was almost as high as the people who lived there all the way. So if you look about this group here, they, by moving away from traffic, dropped their risk almost down to baseline. So this is like stopping smoking, you're stopping pollution. Unfortunately, not everybody has the choice to move wherever they want to do, but we can actually think about moving the roads away. Here's an example of doing that. This is a freeway in Munich, Germany. This is one of the major roads that led sort of out to the peripheral road of the city. You can see a high traffic freeway. They put a park on it, tunneled it, they actually filter the air. And you think this is crazy. You think, oh, this is so expensive. Actually not, because look at all this. New land development, now everybody wants to live here. So actually people make money off this. The residents have a park, increases their ability to have physical activity, which we know is good for health, and the local air pollution situation is gone. And actually many cities are thinking of doing this. So this is sort of thinking about the way forward, and we had a workshop a few years ago and sort of summarized much of this. I want to sort of end by going into some interactions with other stressors that are also linked to urban design. So we know actually that the type of design of a city actually affects how people move around. If you think about very unurbanized, rural, suburban type of areas, because of the distances, all the transportation is through car, very little through transit or walking. The most highly urbanized areas, the dense urban areas like Tel Aviv, you get a mix. So people drive, but they also can use transit, they can also walk. And that's very simple. The sort of density of your urban design both affects sort of how you can get places. So if you live in a design like this where the road network is like this, for you to walk 1 kilometer, you have to walk 1 kilometer in this kind of crazy fashion. And by the time you get tired, you actually haven't gone very far from where you live, where if you live in a very dense, highly connected urban area, when you walk 1 kilometer, you can actually go 1 kilometer because you're going almost straight. What does this mean? Well, we can actually now measure this. Many of you may know about this. It's a website called WalkScore. We can measure how walkable urban areas. So this is Tel Aviv. You can actually enter in your location and find how walkable your neighborhood is. And we can actually map this. The parameters actually characterize how walkable a neighborhood is. Why is that important? Well, it's actually related to health. So the more you walk, your probability of obesity actually decreases. So walking, physical activity is good for health. Unfortunately, when we look at this in relation to air pollution, what we did was we now combined walkability with air pollution with these high-resolution maps. The green are areas that are good for everything. You can walk, the air pollution is low, and these are two different pollutants, nitrogen oxides as well as ozone. The red is bad for all things. You can't walk and it's polluted. But actually most of the area is white. Things offset each other. So they're either walkable or they're polluted, right? No, either walkable or clean or something like that. So they offset each other. Does that mean something for health? Well, this is an analysis we did in Los Angeles. And what we actually found was if you compare low walkable neighborhoods to high walkability neighborhoods, you get a decrease in the number of deaths from ischemic heart disease. So because people in these areas have more physical activity, but that's offset by the increased deaths due to increased exposure to air pollution. So again, what can we do about this? What we need to do about this is actually think about now separating people from cars. Another way people get around is cycling. So this is a study we did a few years ago. We had somebody cycle. We measured air pollution when they're cycling, and we know that when they get to places like this where they're next to traffic, we measure higher levels of air pollution. Lower levels here, higher levels here, higher levels here, etc. Actually, the pollution exposure is not increased that much, but what's important is when you cycle, the reason that it's good for you is that you're breathing, you're pumping more blood through your system, but that elevated breathing rate, which is about 2 to 4 times higher than at rest, what does that do to the air pollution? Well, you bring in more of those pollutants, so that's what matters. So what do we need to do? We need to, again, think about how to do this smarter. There's been two prominent studies, but actually about 10 studies now done in the world looking at whether cycling in a city is good for you or bad for you. What do we tell people? And it's actually very clear that the benefits of the physical activity outweigh both the risks of increased air pollution exposure and the increased risks of accidents from cars hitting you on a bike. And of course, these depend on how you design your city. So whether you have sort of safe and separated places for people to cycle, or if they're separate, if they're cycling in the middle of traffic, that has impacts on their air pollution exposure, also, of course, on their risk of injuries. But we actually shouldn't let people have to even choose. They should be able to cycle in a way that's safe and has low air pollution exposure. Here's a little tool that we developed in response to actually public requests that it's a route planner where people could say, I live here, I want to go here, and I actually want to cycle in a way that's either the way that makes me go up the least hills, the shortest path, the one that's greenest, or the one with the least air pollution. And now the website can tell them where to go. And this is actually the kind of thing not only should people be using, but actually planners should be using to design infrastructure. So again, I'm thinking about cities of the future. The thing that I'm starting to work on now is actually thinking not about bad things in the environment, how can we actually make cities health promoting? And there's a growing body of literature that suggests greenness, contact with nature is actually good for you. And it's a different way to think about environmental health. Instead of thinking about let's measure all those bad things, let's also think about what's good in the environment and how can we measure that, and can we look at impacts of health on that. So I don't have anything to show. We're right in the middle of this work right now, but I think this is sort of a growing area. So just to close, some of this research I think suggests that we ought to be thinking more about strategies to separate major roadways from people. If any of you have been to New York City in the last few years, this is Times Square, which used to be a major intersection in the middle of New York, full of cars. Now it's an urban plaza. Really hasn't had any negative impacts on the traffic flow in the city, and it's had huge positive impacts on the quality of life. This is Seoul, Korea. This used to be a freeway. Now it's an urban park. Improved quality of life, actually improved local air pollution. no negative impacts on traffic. And here's an example of infrastructure to promote active transportation here in Tel Aviv. So you have a start here, certainly, in terms of doing that. So thank you.